Hey, this is Bill Simmons from the Bill Simmons Podcast, here to tell you that Michelob Ultra, the official beer partner of the NBA, is bringing NBA fans closer than ever this season with chances to win great prizes, including courtside tickets. Enter now at MichelobUltra.com/courtside. Michelob Ultra courtside 25 to 26. No purchase necessary. Open to U.S. residents 21 plus. Begins on October 1st, 2025 and ends on June 30th, 2026. Multiple entry periods. See official rules at MichelobUltra.com/courtside for free entry deadlines, prizes, and details.
'Tis the season for all your holiday favorites, like A Very Jonas Christmas Movie and Home Alone on Disney+.
Should I burn down the tree? I don't think so.
Then Hulu has National Lampoon's Christmas Vacation.
We're all in for a very big Christmas treat.
All of these and more streaming this holiday season. And right now, save big with our special Black Friday offer. Bundle Disney Plus and Hulu for just $4.99 a month for 1 year. Savings compared to current regular monthly price. Ends 12/1. Offer for ad-supported Disney Plus Hulu bundle only. Then $12.99 a month or then current regular monthly price. 18 plus terms apply.
The More Money Show with Steve Moore on the Red Apple Podcast Network.
My next guest is Phil Kerpin, who is really one of the experts on healthcare in America and why it is we spend more and more and more, and we're not getting better healthcare outcomes. So it's not a very efficient healthcare system at all, and is pricing a lot of Americans right out of the market. Phil Kerpin works with me at Unleash Prosperity as our healthcare expert. He is also the president of American Commitment. Phil Kerpin, thanks for joining.
Hey, my pleasure, Steve.
Okay, so we have not solved the healthcare problem at all. We just kicked the can into 2026, and it looks like there may be another shutdown over what we're going to do about healthcare. Phil, let me just ask you a big, broad question. What should we do about the stampeding cost of healthcare?
Well, I think that we need to have a functioning market. We need to have real price signals, and we need to have real competition and choice. And we've destroyed it in healthcare. And we've got some policies that have driven massive consolidation. So in a lot of places now, you basically have one or maybe two hospital systems that have consolidated basically all the doctors and nurses to be employees. You've got a handful of giant insurance companies that own the pharmacy benefit managers, and everything's become extremely vertically integrated with very little meaningful.
Which is another way of saying bureaucracy.
Yeah, super bureaucracy. We basically have everything in healthcare now runs through basically one, two, or three bureaucracies, often all three: a government bureaucracy, a health system bureaucracy, and an insurance bureaucracy. And sometimes they disagree with each other, and everything becomes a nightmare and very confusing. And of course, you layer all of this on, and at the end of the day, we're paying a lot more than we would for the same service if you just paid the doctor directly and didn't have all of that extra overhead. And we've got a lot of complexity that it's been made worse by, every round of reform seems to just add more bureaucracy on top and more complexity and less meaningful competition and choice. And a lot of this has been driven by federal payment policies. So, for instance, in Medicare, Medicare pays more for the exact same doctor's visit if your doctor is owned by a hospital system than if your doctor is independent. So what's happened? All the physicians' practices have all been gobbled up, as you would expect. We've got, similarly, we've driven everything towards these very large insurance companies who get massive subsidies. And, it's just become a very convoluted system. And the number of choices that most people have are very limited. As a consequence of that, you have a limited number of plans. And then even within that, you have a limited number of systems that you can deal with. A lot of doctors that have taken early retirement or have, sold their practices. And so what we've been urging is, look, we don't like at all that they're probably going to extend the supersized Obamacare subsidies.
By the way, just to interrupt you for a second, this is our putting
this is our most favorite patient project at Unleash Prosperity now. Yeah. And if folks want to see it, go to mostfavoritepatient.org, and you can see kind of all of the papers and all of the articles in the background that we have on this. And we've been focused very heavily on the prescription drug pricing issues and supporting the president's agenda to try to bring down drug prices. And we're actually now going to roll out our insurance reform agenda as well. Right. But our view, Steve, is that if there's some kind of extension of these supersized Obamacare subsidies, subsidies, which, we'd prefer that there not be an extension, that they deal with some of these real structural reform issues. But at this point, it looks like they probably want to do some kind of a deal with some kind of an extension for political reasons. To us, if you're going to do that, you've got to accomplish some real reforms at the same time to at least make it worth it, to at least be directionally beneficial overall. And you've got to deregulate so that people have more choices, so that there's more competition. And you've got to have, some real skin in the game in terms of some of the subsidies at least going to money that people don't have to spend but can save for future use. And you got to have choices, not just a one-size-fits-all by, whichever Obamacare plan you want, as long as it's the exact same benefit design that covers the exact same things, which is, like Henry Ford, any car you want as long as it's black. Let's deregulate. Let's have choices if people want to buy a short-term plan that has a different benefit package, or if people want to get a very high deductible catastrophic type plan, or if people want to pair a very high deductible catastrophic plan with a subscription to a direct pay primary care doctor. Let's open all of that up, deregulate it so that people have more choices at a minimum, if we're going to, especially if we're also going to extend those supersized subsidies in some form.
Well, one thing that needs to be done, if we're going to try to keep this very simple for people, because the healthcare system is so mind-numbingly complex, probably intentionally so. But let's just assume do a little kind of mind game here, and let's say that we started paying for healthcare bill the way we pay for groceries. So we go to the grocery store, we look down the aisles, we see all the things that we could buy, and sometimes, you have to buy the Safeway ice cream because you can't afford the Haagen-Dazs ice cream, but every price is there, you know what everything costs, you go to the checkout, and you pay your bill, and you're a cost-conscious grocer because you know what your budget is. That's the furthest. Why can't we have something like that for healthcare? You go to the doctor and it just lists on if you go to this doctor or this doctor, it's going to cost you so much. If you get this procedure, it's going to cost you this much, and let people economize on their healthcare by being cost-conscious consumers. As you and I have pointed out so many times, healthcare is maybe the only thing in America where we never ask what it's going to cost.
This shrimp and coconut sauce is divine. What's your secret?
Goya coconut milk.
How does it taste so good?
It's all in that real coconut flavor and that rich, creamy texture.
What about thickeners and added sugars?
None. Just smooth, coconutty goodness.
What can I make with it?
From curries to sweet treats like coconut flan, the possibilities are endless.
Goya coconut milk. Take your cooking to the next level. No question about it. Find it in the Goya section of your local grocery store. If it's Goya, it has to be good.
The Who's Down in Who Newville were making their list, but some didn't know Walmart has the best brands for their gifts.
What about toys? Do they have brands kids have been wanting all year?
Yep, Barbie, Tony's, and Lego. Gifts that will make them all cheer.
Do you mean they have all the brands I adore?
They have Nintendo, Nespresso, Apple, and more.
What about...
So the Who answered questions from friends till they were blue. Each one listened and shouted, from Walmart? Who knew? Shop gifts from top brands for everyone on your list in the Walmart app.
No one should have to choose between their own safety and their pets. But nearly half of domestic abuse survivors delay leaving because they can't bring their pets with them. Purina is helping to create more pet-friendly domestic violence shelters through the Purple Leash Project, so survivors and their pets can escape and heal together. Visit Purina.com/purple to learn more.
Does it ever feel like you're a marketing professional just
speaking into the void?
But with LinkedIn ads, you can know you're reaching the right decision makers, a network of 130 million of them, in fact. You can even target buyers by job title, industry, company, seniority, skills, and did I say job title? See how you can avoid the void and reach the right buyers with LinkedIn ads. Spend $250 on your first campaign and get a free $250 credit for the next one. Get started at linkedin.com/campaign. Terms and conditions apply.
Yeah, it's amazing. There's some reforms we'd like to see that I think would really move things in that direction. One of them is what's called direct pay parity, which is the idea that if you do pay cash for a service, it ought to count towards your deductible and towards your out-of-pocket maximum, because right now it often does not. And so even if you could negotiate and get a lower price, you just run it through your insurance and pay that price anyway because you want it to count against your plan. So that would be a very beneficial reform. Also,
well, how about Phil? How about if we just did? Why don't we just have, catastrophic health insurance. So if you have
I think that should be available for everyone.
But it's not.
That would be a huge.
Right.
It's actually banned for most people. The Trump administration, and this is important for your listeners who might be in this category, one of the things the Trump administration did a few months ago is they said anyone who wants to buy catastrophic insurance through Obamacare, the catastrophic exchange plans, which are still regulated but tend to have lower premiums than the other plans, if you do not qualify for Obamacare subsidies, that is now considered a qualifying event to get the catastrophic coverage. So you get an automatic hardship exemption if you can't get subsidies. So if you make too much money, if your income is above the cutoff for subsidies, you can get a catastrophic plan, with the exception of 4 states. There are 4 states that are refusing to comply with that, and they say, no, you can't. Those 4 states are Connecticut, Maryland, D.C., and California.
Now,
so hold on,
states, you're out of luck. Why would these states prevent someone getting a very efficient form of insurance for them that would protect them against it's like, if you have a home and you have fire insurance, it's a rare,
honestly,
it's a rarity.
I think just to spite Trump, I think because the Trump administration did it, they said they don't want to go along. So those are the 4 states that have not gone along. But most other places now, if you cannot qualify for the subsidies, you can get a catastrophic policy. So that's a positive. I would love to see Congress make that permanent so a Democrat president can't reverse it. But that is something the Trump administration did that was helpful. One of the things, and you may disagree with me on this because you're a little more of a federalism guy than I am on some of these issues, but I would like to see federal preemption of the state licensing laws that are called certificate of need laws that basically let the incumbent hospital systems veto competition. And in a lot of states, you cannot open a surgical center, you cannot open a clinic, you cannot open a hospital unless the hospital that already exists gives you permission. That's insane. So I would get rid of all of those nationally. I think Congress should do that, in my opinion.
Bill Kerpin, thanks so much for joining this week. Folks, this is the More Money Show, and we'll be right back.
Thanks for listening to More Money with Steve Moore. You can hear More Money with Steve Moore Saturday afternoons at 1. If you like the podcast, share it with your friends and listen anytime at WABCRadio.com and download the WABC Radio app. Hit that subscribe button on all major podcast platforms. Plus, follow WABC on social on Instagram, TikTok, Facebook, and X. See you next time for a new episode so you never have to wonder,
what the heck is going on here?
The holidays mean more travel, more shopping, more time online, and more personal info in more places that could expose you more to identity theft. But LifeLock monitors millions of data points per second. If your identity is stolen, our US-based restoration specialists will fix it, guaranteed, or your money back. Don't face drained accounts, fraudulent loans, or financial losses alone. Get more holiday fun and less holiday worry with LifeLock. Save up to 40% your first year. Visit LifeLock.com/podcast. Terms apply.